Good morning, everyone. For those who don't know, I'm Cheyenne, occupational therapist here at Scotia Village. This is Diane Britt. She is a certified occupational therapy assistant here at Scotia Village, and we work with Trinity Rehab. And today we are going to tell you all about managing urinary incontinence. So don't let urinary issues dampen your day. Flush them away. So in managing incontinence, more than 13 million people in the United States, male and female, young and old, experience incontinence. Women experience incontinence twice as often as men does. Pregnancy and childbirth, menopause, and the structure of the female urinary tract account for this difference.
Causes of incontinence. Incontinence is often seen as part of aging, but it can occur for many other reasons. Some of the reasons may be for a short duration, including urinary infections, medications, constipation, and muscle weakness. Thank you. Bladder control. The body stores urine in the bladder. During urination, muscles in the bladder tighten to move urine into the tube called the urethra. At the same time, the muscles around the urethra relax and let the urine pass out of the body. Incontinence occurs if the muscles tighten or relax without warning.
So there's 5 types of urinary incontinence. The first one is stress incontinence. Stress incontinence is the most common type. Stress incontinence occurs when the pelvic floor muscles that surround the urethra are weak and fail to hold back urine when pressure is placed on the bladder. This often occurs during laughing, sneezing, coughing, running, jumping, anything including lifting, anytime there's pressure placed on the bladder. Women with stress incontinence may have pelvic floor dysfunction due to pregnancy and childbirth, like we talked about before, which puts stress or pressure on the bladder and causes trauma to the pelvic floor muscles. This E word, episiotomy, which is a procedure often used to ease childbirth. So all of these are things that they go through. So perineal injury or tearing during childbirth. Injury or trauma such as a pelvic fracture, and that's not just in women. Men can have pelvic fractures as well. Inflammation such as a swollen bladder from a UTI or urinary tract infection, which we all experience. Surgeries or a lifestyle that involves too much sitting. Urge incontinence is the second type of incontinence. This is when you experience a strong, sudden need to pass urine. People with this type of condition often experience a leak before reaching the bathroom. Pelvic floor weakness or tightness in the form of muscle spasms may contribute to bladder contractions. This dysfunction may be one that's self-taught. And this is known as just in case avoiding. So whenever you say you're going somewhere and you say, oh, well, let me go to the bathroom just in case. Or I'm fixing to go to bed, let me go to the bathroom just in case. And over time, when you feel this strong urge, it's because your bladder has learned to do that, leading to urge incontinence. So ways to help with urge incontinence, we call this Kegel exercises, but it's also a strategy that you can do that's not just an exercise, it's just a strategy to help in the moment. So it's tightly contracting the pelvic floor muscles. It can help to reduce the sense of urgency when you pinch the urethra to keep it closed. So in layman's terms, it means so when you have to go to the bathroom and you're trying to keep it You squeezing, trying to hold it. So it's that contraction of the urethra. And you can also manage urge incontinence by reducing your caffeine and sugar intake, reducing acidic foods, smoking. These can irritate the bladder, causing inflammation and potentially cause the bladder muscles to contract more. The third type of incontinence is mixed incontinence. This is whenever someone's diagnosed with both stress and urge incontinence at the same time. Functional incontinence occurs whenever leakage is not directly related to the bladder or the pelvic floor muscles. This is whenever there's an underlying condition causing this functional incontinence, like joint pain, muscle weakness overall, making it challenging to move, so limiting your mobility, confusion, delirium, dementia, slow movement and reduced mobility, so having to use an assistive device. And oftentimes using the assistive device can help you to move quicker, just to throw that in there. And physical barriers or obstacles that block access to the bathroom, such as rugs or furniture that may be in the way. Urinary frequency is the fifth type of urinary incontinence, and this is the need to urinate more often than average during the day or night with minimal output. So, like when you need to go to the bathroom, you feel like you have that urge, but you go and it's just a little bit maybe that comes out. This may be caused from a UTI or other conditions affecting the kidneys, bladder, and urethra. Any medications like diuretics or sensitivity to certain foods or drinks like caffeine or alcohol.
Therapy's role: assessment and individual assessment of daily routines, habits, and environmental factors. Bladder training techniques, which is urge suppression strategies, voiding diary, and timed voiding. Adaptive strategies: clothing modification, absorbent products, and bathroom breaks during outings. We can also look at environmental modifications, which may mean decreasing clutter, rearranging furniture, and installing grab bars. Strengthening and conditioning the pelvic floor muscles, overall body strength, and coordination to assist with ability and balance. And also assisted devices as in portable urinals or the bedside commodes. In summary, by taking an OT approach that considers both the physical and social aspects of urinary incontinence, OT can significantly enhance the quality of life for individuals dealing with this condition. Does anybody have any questions? Okay.
Talk about UTIs.
Talk about them?
Talk about them.
Well, it's a urinary tract infection, so I feel like the nurse would be a better person to explain that. Okay, all right.
So oftentimes, urinary tract infections can be caused from several different things. So like, for some people who may experience urinary incontinence and they may wear some of the absorbent pads or pull-ups, a lot of the times they say, oh, it's not really wet or it's not dirty, or even if you don't wear that and your clothes is just damp, all of those things can contribute to causing urinary tract infections. So if you're sitting in moisture or depending on your lifestyle, so maybe with younger people or some older people, if your clothes is too tight, what other things can you?
Like the material of what your undergarments.
So she said the material.
Plays a role into that. Hair.
Yes, and pericare, especially for women. So like whenever you're wiping.
The way that you're cleaning your
over in skilled, especially, we get to see a lot of this because it's just kind of the nature of how things go. But if you have situations arise where you have medical issues, like a fistula or things like that, those kind of things, or a wound, just say you end up with a wound, it could be an abscess, it could be a pressure wound, it could be anything. It doesn't have to just be a pressure wound, though, so don't think I'm talking about just pressure wounds. It could be an abscess or anything. Those things play a role in that because they can get into, when you're cleaning yourself, you can get contaminated from those kinds of things. So urine hygiene especially. Those are probably the most common, like she mentioned, like sitting in a dampened environment without changing as frequently as you need to. And then, and sometimes what we end up doing in skilled a lot of times is putting people on what we call a toileting schedule. Sometimes that's because we're trying to train the bladder to go every 2 hours so that even if you don't feel like you need to go, you go. Sometimes that is because folks don't realize that they have gone, and so when they get in there, we notice that brief or that pad for women is damp, and they never realized it in the hour ahead that they weren't going to the bathroom. So putting them on that time toileting schedule helps us to get them looking at that more closely and trying to take care of that versus just letting it go 3 and 4 hours. So a lot of times you'll hear us talking over there about time toileting or toileting schedules, and what we're saying, typically we would tell somebody to go at least every 2 hours. Even if you don't feel like it, go and see if you can go at that time. And that'll train your body to get to going every couple hours. So you'll notice the more you do that, the more frequently you start going, you have less accidents in between. So it's less time for you to sit in sold brief, or for women we have all kind of products that we wear, but also for men too, if you're wearing Depends or even just having leakage and you just need a little extra protection. If you don't realize it's wet, you're not likely to change it, which could cause UTIs.
Yes.
Brenda,
Yes,
how dangerous is an untreated UTI?
it is very dangerous,
Here.
especially in you guys' population.
It is very, could everybody hear what he asked? How dangerous is it? In you guys' population, it is very dangerous. You guys have probably seen it. If not, I'll just tell you, we start seeing a lot of times for us, and nursing may not necessarily agree, so if we got any doctors, you might not agree either, but one of the first signs that we see with folks is that they start to get a little bit confused, a little bit more confused than maybe normal. Even somebody who has some cognition deficits, we start noticing some things just seem a little off. Then you start having the urinary frequency where they're trying to go, even if they don't feel like, they go and they're not really going that frequency they talked about, or they'll start having a really foul odor to their urine. So those are all signs of that. But it can, if you let it go long enough, it can put you into shock. You all heard of septic shock, and that'll end you in the hospital for a few days. So it is very important to stay on top of those things because it can get bad, just like any other infection. It can get bad enough that you end up having to be treated in the hospital. And, another thing that we see frequently over in skilled, and you guys may be familiar with this too, is frequent UTIs. There are people who just are susceptible to UTIs, and it's how the body's made. Nothing you're doing, nothing, we can do necessarily to change that. It's just how it works. So sometimes they'll put you on what they call a prophylactic antibiotic, and that's just a lower dose of an antibiotic for pretty much the duration of your life, so that they'll try to keep you from getting them. Sometimes that works, sometimes it doesn't. The other side of that we see is that people get immune to antibiotics, and then it becomes hard to treat. So you end up getting to a point where you may need to be treated with IV antibiotics, and there's only one or two that'll actually treat you once you get resistant to those antibiotics. So the big thing, and this is the reason it's so important, is because UTIs come from a lot of different causes and bacterias. So you need to make sure if you are going to the doctor, and most doctors do this, they're going to do that, you urinate in the cup and, oh, it's dirty, they're checking that out, but they're also going to do a culture so that they know what bacteria that urine is growing. And that's how they know what antibiotic to give you, what antibiotic is going to treat that specific bacteria. So that's the other importance of staying on top of that, is that you get the correct treatment.
Tell us how we can strengthen or improve our floor muscles.
Oh, okay, I'll let Cheyenne
So I'll
do
take
that.
this one on. The pelvic floor muscles is all of the muscles that are in this region. So Kegels are the most common one. Diane made this very clear. It's one that you can do, and people should never even know you're doing it, because it's that internal muscle where you're just squeezing, kind of like whenever you're trying to hold your urine. Now, we don't recommend that you do that. When you're going to the bathroom, go to the bathroom. But that is what you're doing, is squeezing that muscle. That's the Kegel. Also, we do a lot of, a lot of the times it kind of looks like physical therapy exercises. I'm not going to demonstrate them for you because that would require me to get on the floor. But we focus on strengthening all of these lower abdomen muscles. We strengthen your back muscles and teaching you just different exercises that you can do to strengthen all of these muscles. They're more lower extremity, but it's not focusing on the lower extremity, it's focusing on the pelvic floor muscles.
And I'll add to that, especially if you've been to PT anytime recently for a back, you've probably seen us do what we call abdominal bracing, which kind of feels a lot like the Kegel exercise, where you're trying to hold it and, crossing your legs, trying not to go. But it's so you're pulling your belly button in towards your spine, and you're tightening those abdominal muscles. So that's a very intrinsic. The intrinsic muscles you're working on there too, very similar, but that's one that we would probably have you do. So just think about laying on a bed, and this is not easy. So if you've tried it and can attest to it with therapy, but just think about laying down and you're trying to pull your belly button in to the bed or whatever you're laying on. You're going to hold it for about 10 seconds. But you're going to breathe at the same time. So when you hold it, you're going to count out loud for those 10 seconds while you're still holding the abdominal muscles tightened. So everybody in here, I want you to try that when you get home and tell me how that works. Okay? Because that's very similar to the Kegel, kind of the same thing. It's not something you really see. We can. In therapy, we have ways and places that we can touch that we know what muscles you are tightening. So we can look at things like that. But for you specifically, it's going to be hard for you to tell that, because you know you're doing what we're telling you to do, but that don't mean you're doing exactly what we're trying to get you to do, if that makes sense, because it is a hard exercise to do, just like the Kegel one. You can try and tighten, cross your legs, do the pee-pee dance, I call it, and kind of feel that same feeling, but it's not a very big feeling, so it's hard to without having you, lay out on our table and feel muscles in your abdomen, it's hard for us to tell you if you're doing it exactly right.
Is the color of the urine significant in any way?
Absolutely. If you don't know, if you are not drinking enough water, that's a huge one in helping you guys stay free of UTIs. But if you're not drinking enough water, you're going to know that by your urine, because it's going to be dark. You want your urine to almost be like water, like the lightest yellow that you can find. Unless, now, I will say that if you have kidney issues that you already know of, that could be different. If you're taking certain medications, that's going to be different as well, because there are medications that will change the color of your urine. But yes, it is significant. And if it's dark, you know you need to be drinking more water.
I'm going back to the exercises that you were talking about. How many reps do you suggest at one time?
So I would start with, because you're holding it for 10 seconds, I would start with 5 to 10 reps, whatever you think feels comfortable to you, and then work up till you get to those 10 reps. So you're squeezing those abdominals in, you're holding it for 10, and like I said, count out loud, because that's going to ensure you're breathing. If you can't count out loud, chances are you're probably not breathing. So make sure you're holding your breath, and you're going to pass out. So make sure that you're counting out loud. Do that for 5 times, see how it feels, and then if you can do 5 more, go ahead and do 5 more. But that's a pretty good amount. And then some people like to do it 10 in the morning, 10 in the afternoon. You can do it twice a day. There's nothing, you're not going to hurt anything by that. It's probably going to be better to do it that way.
Let's see.
Reverting back to the avoiding every 2 hours, is that in a 24-hour period, or should there be any break in there for is that getting up at night every 2 hours?
You don't necessarily have to do that at night. We don't typically try to wake people up at night. If there are people who say, I want you to wake me up, then we will. But you don't want to interrupt your sleep. You don't want to do that, because that's going to increase your falls, number one. You're going to be groggy getting up like that. It might be that you go a little longer at night. That's typically during waking hours is what we say. So if you're having trouble at night, and that's where your trouble is, you might want to try to get up. I wouldn't say every 2 hours, but every 3 or 4 hours. That's completely up to you, but if it's going to interrupt your sleep and make you groggy,
One thing that I suggest, so I mentioned it a few times during the PowerPoint, that caffeine is a major irritant to the bladder. If you find that you have more urinary incontinence at nighttime, you may want to cut off your caffeine intake at lunch and just minimize how much fluid you're drinking during the evening. I want you to stay hydrated, but cutting out that caffeine, so no coffee, no sodas, no alcohol, cutting those out, because then that increases the irritant to the bladder.
I'd like you to address diet with regard to urinary tract health.
That's a good one. I don't really know a lot about diet in regard to urinary tract health. You guys want to speak more to that? Because I can speak fluid-wise, but I can't speak diet-wise, what would contribute
I
to
know that like
that.
acidic foods contribute to irritating the bladder. As far as other foods, I don't. So maybe like foods that have a lot of water, like watermelon, I know is high in. You have any?
No, I just know that diabetics urinate more often, so that's, and that would be sugar and carbs and those kinds of things, yeah. Yeah, so.
But that would be less of those.
Yeah.
So,
Right, just keeping your sugar normal.
One of the slides mentioned dairy. How is eating and drinking dairy related to urinary problems?
I would think that that's probably one of those that are irritating the bladder. If I had to guess,
I wonder if you have an allergy to dairy, because I think it mentioned that food allergies maybe, and that's not uncommon to have an allergy. Yes, yes, to dairy. So,
It would not be for everybody. It would be for people who already know they have a sensitivity to dairy, lactose intolerant, or even just, you don't even have to necessarily be allergic to have a little sensitivity to it. And well, if you're lactose intolerant, you better not participate. And that would go for, anything. And I think some of that too is probably more applicable to bowel incontinence than urinary, because if you're lactose intolerant, you know what happens when you drink or eat something that has lactose in it. So a lot of it's probably, that is more related probably to, and is that what you were kind of referring to there, or were you referring to?
I know a lot about this because I've had this problem for a long time.
Uh-huh.
Give her that mic, man.
A diet is very, there are a lot of things.
That they tell you not to eat?
Yes.
Like,
One
give
of
us some
Any
examples.
dairy products.
Okay.
Not just milk, but any dairy products. I mean, there's a long list. I mean, it's like a dictionary, a dictionary page of.
That's
things
interesting, because I
to
have
avoid.
never heard of
yes.
that. Even in our nursing department, we've never had anybody say we don't have a diet for urinary incontinence, which is funny, because if they tell you, if you have it, so I'd be interested to see that if you have a list.
Oh, I have several.
Most people lose their ability to digest lactose with age. Chinese people or Oriental people tend to lose it very quickly. That's why Chinese food uses very little cheese. But other Caucasian people tend to lose it in middle age, and black people, it varies depending on where they came from. But all human beings tend to lose some of their ability to digest lactose with age.
As they age. That's really interesting that you mentioned specifically Chinese food and the Chinese. That's really interesting.
Yes. Okay, so our speech therapist is with us. So she's going to contribute to our dietary conversation here.
It's not that I know a whole lot about it, but I know that things that are good in fiber are really good for your urinary tract, as well as like probiotics. There's certain berries that'll help us out. Sorry, I see you back there. There are certain berries that will also help us out. So like raspberries, cranberries. Sometimes our doctors will say drink some cranberry juice and things like that.
And I know you were asking about medications. So, I know the biggest thing is like Lasix. A lot of the times they'll put our people on. Thank you, Alexis. They'll put you on Lasix, like if you have a fluid overload in your body. Congestive heart failure is a major one that usually gets Lasix. And that is a diuretic that increases urinary output.
He's on two, they're not working.
Here you go.
Yeah, he's on two medications and they're not working. Yeah, because he gets up every 2 to 3 hours to go to the bathroom, day and night. He is not getting his sleep.
So, that's a good. Well, I would maybe recommend some counseling. I'm kidding. So if you are on medications and you're finding that these medications are not working, then definitely talk to the doctor. Let them know, hey, this plan is not working. Is there any other options we can take? So if they have not recommended you to see therapy, you can get a referral from your doctor to see occupational therapy. It could be that some of these pelvic floor muscles are weak. We can work with you on implementing some of these strategies that we've talked about. And I'd be glad to come in and help you. We can come to your house. I'm not going to ask you to come to the therapy room for a topic as sensitive as this, because I realize this is very personal. And this is one that we would come and see you for in your own home.
And I was going to add about the medications too, and talking to the doctor. It could be timing of the day. Maybe they could make some adjustments in that if it's keeping him up more at night. I don't know his routine, but it could be something as simple as that. But it could be that he needs to be on something different too. So I would definitely talk to the doctor about that if you feel like it's not working. Yeah, because you don't want, I would assume he's got fluid overload if they've got him on 2 medications that are diuretics. So you don't want to get into that. And a lot of times, unfortunately, it is a very fine line when you start talking about CHF and fluid overload and things like that, to get that, you want to get the fluid out, but you also want to watch all the other vitals and not bring down the blood pressure and not have them up all throughout the night, risking that they're going to be falling at night and things like that. So it's a really fine line, but you do want to talk to the doctor about that to let them know you don't feel like it's helping, because it might be an adjustment that needs to take place there.
Urinary incontinence and any type of incontinence is truly a subject that requires interdisciplinary treatment approach. So just like we've learned today, here we're learning from y'all something that we didn't know about with dairy, because that's not necessarily our specialty. So that's why it does take an interdisciplinary approach. So we would have to correlate with your doctor and you as the primary person, because it's your life, it's your body, and you know your routine better than anybody. And then using our expertise in implementing strategies, we correlate also with physical therapy. So there's some exercises that I admit we don't know, but that's why we have the entire team that we can collaborate with. And it's definitely something that takes all of us, because there's a lot of medications out there that we don't know about, that your doctors do know about.
What about Imodium? Do you, is that okay for the body, Imodium? I beg your pardon?
That is one that down in Skilled I can tell you is frequently used.
Yeah, and it's just a tiny, half of one of those little tiny, that's all you.
Yep.
Yeah.
She asked about Imodium. It would be more pertaining to bowel incontinence, for sure, but it's a frequently used, for upset stomach, frequently used medication.
Yeah, more for bowel.
You take it for stress. Uh-huh. Okay. You use it more for stress.
Is that something that the doctor told you to do, or you found works for you? That's an interesting concept. So she was saying that her doctor didn't tell her to do it, and she's found that this is something that works for her. She just takes a small bit of it whenever she has to do something stressful, so like giving a speech. So, and I'm assuming what makes sense to me is if you find that with increased anxiety and stress, it gives you an upset stomach, then that probably alleviates some of that prior to. So that's a good strategy I've not heard about ever. But I think that's a good strategy to use. Yeah. Any other questions, comments, concerns, complaints, criticisms? Okay. So, if you have a question or a concern that you do not want to talk about in front of everybody, totally understandable. We are available Monday through Friday during working hours from 9 to 5 p.m. down in the therapy gym. If you catch us in the hallway, you can always ask us something. Amanda's got an email. Scotia,
Back on that back table, some of you probably already have these, but.
use your mic.
I keep forgetting I have this. So back on that back table there we have some pamphlets that have our number on. There's also a magnet if you don't already have one. We try to give those out frequently when we do these and put them in cubbies. So our number is on there as well. If you wanted to just give us a call and talk to us over the phone, or just say, hey, I need to talk to somebody, can y'all come and see me, let's schedule a time. We can certainly do that, because like Cheyenne said, we don't want to put anybody on the spot and make you talk about your issues in here, or things that you might be concerned about future-wise, because this is something you have to think about. You may not be dealing with it right now, but we all know we're all getting older, so it could be something that we're dealing with in the future. So if you have questions or things you want to talk about more privately, we can certainly do that.
Is there a pamphlet on the exercises, you know, like when you take therapy, sometimes they'll give you a pamphlet of the
We
exercise?
can do that. What we'll do is we'll put them out in the we will put one in the cubbies. Probably not this afternoon, but in the next few days, be looking for it in your cubbies. We will put out a pamphlet to tell you. This was recorded. It's on YouTube Live on the Scotia page. So if you guys know folks that want to listen in and weren't able to make it, just send them to the Scotia YouTube page. It is live, so it should be on there shortly following this. Yep, but we will make sure we put out